Hi, I'm Michael Palmer with 45 Urgent Care with your tip of the week. Now, being that we're at the start of the new year, I thought it would be a good thing to talk about something that's usually high up on most people's New Year's resolution if they do this, and that's quitting smoking. Smoking is a health hazard that, unless you've been living underneath a rock, you've probably heard about it. Now, what you might not know, though, is that each year 480,000 people die from cigarette smoking. That is more than what we see with alcohol, illegal drugs, firearms, all combined together. So, this is why I felt like this is a very important topic, being the first of the year, that we can talk about and tell you some things that can be done to kind of help you quit. Now, the first thing I suggest for anybody that's thinking about quitting smoking is to get in with your primary care doctor to be able to talk about things that can be done. Your primary care doctor can at that point, counsel you on the best ways to be able to stop smoking. Now, some of the many treatments that are out for smoking cessation is there is counseling that can be done. There is also medications that we have. Now, both of these combined has really shown the best chance at being able to quit smoking. There's varying degrees of medications that we use and usually try to tailor it to what's best for the patient. Now, I'm going to talk about another one that a lot of providers, I'm sure, is getting, that I know I get almost on a daily basis. How does vaporizing or e-cigarettes help with smoking, and is there any problems with it? Let me say this. Right now, there's still very limited amounts of studies that has shown that there is any reduction, but there are a few that have come out that says there might be a slight reduction in patients that they're able to quit by using e-cigarettes. Now, with that being said, there's been very limited studies completely that's been able to be done for long periods of time that has shown if e-cigarettes are safe. So the jury's still out on that. So I know a lot of providers get that question, so I thought it was a very important thing to discuss. Now, what I like to do with patients when you come in, find out if you're motivated. Motivation is the most important key with this. If I have a patient that is motivated, I can help you with the willpower to stay off cigarettes. Now, what I suggest, anybody out there that is thinking on making this their New Year's resolution to stop smoking, get in with your primary care provider and please talk with them about the alternatives that we can do to help you quit this cigarettes that's been going on for a while. Now, any questions? Any people here in Jackson? I'm Michael Palmer at 45 Urgent Care. We're located at 149 North Star Drive. Stop by. We'd love to talk to you about it. Now, thank you all for joining in. Once again, I'm Michael Palmer with your tip of the week.